So this is part 2 of our TMJ series. The first video touched on all the potential causes of your TMJ pain. Now, in this video, we're going to go over some tips to help relieve the pain. But keep in mind, unless you know the root cause of your pain, it is extremely difficult to know which tips are going to work for you. It's kind of more of a crapshoot of trying them all. I also have a free guide on my website that you can download. Again, it has a bunch of tips in it, but you kind of have to play around with it and figure out which one is going to work for you. The best thing to do is to get an evaluation from a physical therapist who specializes in TMJ so they can point you to the exact problem. And then from there, you can try to fix it on your own or continue to go to therapy for it. Now, let's look at a couple tips to address the muscles. So again, the temporalis muscle is above the cheekbone, and the masseter is from the cheekbone down to the bottom of the jaw. So what you can do is for the temporalis, you can dig in there, find your cheekbone, and move from the cheekbone all the way up. And I like to open the mouth at the same time, because as the muscle's stretching down, you're pushing against it up, like this. You can do the same thing for the masseter. Start at the base of the jaw and open. And if there's restriction, adhesion, spasm in those muscles, this can affect that and help bring the muscle back to its natural, healthy state. Now, if it's more of a capsular or disc problem, that's harder to fix on your own. But one tip I could give you is this jaw opening where the tongue is at the roof of your mouth. So you're basically like this. Now this helps to reduce tension while you're opening up the jaw, and that can help to stretch out the capsule a little bit. Repositioning the disc, there's not going to really be a tip that's great for that. If you find that it really is a true disc issue, there are certain joint mobilizations that a therapist can do with you to help stretch out the joint and try to relocate the disc into the proper position. What you can do something about is fix your posture. Remember, forward head posture, where your chest is rolled forward like this, causes compression back here, causing pain and headaches, and also it causes lengthening of these muscles, so it's hard to shut your jaw because it's fighting against you. So you want to get back. So how do you do exercises to bring you back to that position? Well, the first you could do is to affect your spine. So what you can do is you can get your chest up into a more neutral position and turn your arms out while squeezing your shoulder blades together. Rotate, keeping your elbows at your side. Rotate your arms out and pinch the shoulder blades together and come forward. Making sure not to shrug here, but to come back like that and be relaxed down. This again can activate all the muscles on top of the spine that can pull you up into a better position. Because when you're in a forward position, naturally you're going to look at the ground. So how do you correct that? You do this. And that again causes compression here and lengthening here. Once you've got that good position of being up, now you want to work on getting your head back. And you can do chin tucks. Very common exercise, you've probably heard of them. And what you want to do is first go as far back as you can. That's your 100% of a chin tuck. You want to do the exercise to 90%. So ease off 10% of that and do your reps there. So it would look like this. Find your 100. Ease off. Now do your chin tucks to 90. And the chin should be moving straight back. It should be sliding like this. It should not be sliding like this or like this. Meaning, shouldn't be doing this, shouldn't be doing this. Your eyes are straight ahead and it's straight back. Now you can do 2 or 3 sets of 10 of either of those exercises. For the massages, you could do about 5 minutes to each muscle. And the one where the tongue goes to the roof of your mouth, you can also do for about 3 sets of 10. And you can do all this stuff a couple times a day. So hopefully those tips will help you. You can also go to the website to look at the free guide that you can download where there's about double the tips in there. and see if you can get yourself some relief. If not, find a TMJ specialist in your area, a physical therapist, and have them do an evaluation with you so you can identify the problem and get rid of it.